I welcome you to this online tutorial. My name remains Matthew Ocheleka Itodo, a lecturer with Federal University of Health Sciences, Otukpo, Benue State, Nigeria. And we are still going ahead to discuss water balancing in the body. And now I will be explaining to you factors affecting water intake and water output. And also I'll use this medium to explain to you how water is regulated in the body. Listen carefully as we proceed in this course. One of the ways that one of the factors affecting water intake and water output in the body, one is environmental influences. Like environment affect water intake and water output. Like during the hot weathers, water intake increase, but the water output from urinations decrease. That is to show that when the weather is hot, there will be more water will be taken, while less urinations will happen, in order to regulate the amount of water in the body. Number two factor is, in the case of disease like diabetes or renal diabetes, what we call diabetes insipidus, in which the output of urine is more. In order to regulate the amount of water in the body. And now I proceed to maintenance of water balance, or the mechanism behind water regulation in the body. Listen carefully as we proceed. Fluid intake and urine volume are involved in water maintenance. The amount of fluid taken and the amount of urine released out of the body is very important to maintain or regulate water balance. This water intake and urine volume release are very crucial to maintain the homeostasis of the body. Now, listen carefully. When water is deficit, the testing center is stimulated in the hypothalamus. The testing center now will signal the body that he need more water, he need water. And so, such individual will become thirsty to take more water to regulate or to compensate the amount of water that have been lost in the body. But now I want to make you understand that there are two important factors that affect water regulation in the body. One is antidiuretic hormones. Antidiuretic hormones. While number 2 factor is osmotic pressures. Osmotic pressures. How does antidiuretic hormones and osmotic pressures contribute water regulation in the body? Listen carefully. Antidiuretic hormones, what we call ADH, is located in the hypothalamus of the brain. Is the one that when it is stimulated and this hormones is released, more fluid is taken because testing center is activated already. I think you know that because the testing center has been activated and the testing center have signaled the body for more fluid, so more fluid have already been taken. Now the function of ADH now is to increase reabsorption of water in the kidney. Is this ADH now that will signal the kidney distal tubes or the collecting duct of the kidney? It signals the kidney to increase permeabilities, to reabsorb water from the urine. And thus, water deficit is what? Compensated. So, in that case, less urine is excreted. Less urine is excreted because of the reabsorption of water in the kidney from the urine. Less urine is excreted in order to compensate the deficit of water that is in the body. When I continue, when the body contains excess water, and when the body contains excess water, in this case now the water has been consumed and now there is excess water in the body. The testing center now that always signal the body for more water, it will be inhibited, and so there will be nothing like drinking of water again. Drinking cease, and in such a case, there will be what? Absence of antidiuretic hormone reabsorption, because now the body need so now there will be nothing like reabsorption of water in the kidney again, and so the balance, the deficit of water will be also compensated. So that is now, in summary, is that when there is deficit of water in the body, the testing center will be stimulated for water to be taken, and as the water is taken and then the body is hydrated, there will be more water in the body. ADH increase reabsorption of water in the kidney to compensate the water that is lost. But in this case, there is excessive water in the body already. Now there is excessive water in the body, the testing center now will stop the process of signal the body. Okay? And ADH reabsorption of water in the kidney decrease. 2, I'll be explaining osmotic pressure. The osmotic pressures, you have heard of osmosis. Osmosis is the movement of water across a semi-permeable membrane from the region of low concentration of solute to the region of high concentration of solute. So, having said that, this osmotic pressures is the one that stop the movement of water. That now water should not move from the region of low concentration to the region of high concentration of solute again. That the water should not remain in equilibrium. The reason why he hold the water in hold state to remain in equilibrium is this. During the hypertonic concentration, when the extracellular cell have enough water, and so there's water, and then the water is still flowing from the cell to outside the cell will shrink. But when there's enough water in the cell, and water is still flowing from outside the cell to into the cell will burst. And because of that one, it's good to put the water in, to put the body in equilibrium. So osmotic pressure prevents the further movement of water, and so the body homeostasis will be maintained. We continue with what? Maintenance of water balance. I just explained to you about the mechanism involved antidiuretic hormones and osmotic pressure. This mechanism come into action with deficit or excess water of 200 to 300 ml in body weight. But therefore, if the total body weight is 70 kg month, it may vary. But anyhow it varies, it will not be more than 500 ml under normal physiological conditions. So it means the water must be maintained within this range for the testing Satan to be stimulated, for water consumption to compensate the water lost, or if it is more, to inhibit the action of the testing center to signal drinking of to the consumption of water, and so it continues. Now we'll be talking about disorders of water balance. One of the disorder of water balance that we'll be looking at now, one is what? Dehydration. Dehydration means water depletion, and it is due to deficiency of water. Dehydration occurred in vomiting, diarrhea, diabetes, insipidus, and in lesion of the hypothalamus. Means if there is an injury to the hypothalamus, it can cause excessive water lost out of the body, and so the body becomes dehydrated. Then overhydration, that is edema. In this case, you will see body fluid accumulated in the body, excessive accumulation of water in the body. It is due to excess water in the body. It may lead to edema. It occurs in water intoxications, excessive administration of intravenous fluid. Okay, so this can increase secretion of what? ADH, antidiuretic hormones, because now there's excessive water in the body, so this hormone is secreted for reabsorption of water to compensate that the water lost. Protein deficiency, cancer, and drugs, they are all cases of water disorder in the body. Thank you for listening.